Welcome to the launch of our We Care Committee. The WCC is an expanded version of what we call the Continuum of Care Committee, while we focus more on long-term care nursing workers of the United States, with members of nursing homes and 30 hospitals. We are from the lives of care and to keep everything going in high quality care to help us. We have a great panel of experts and champions, and 1199 SEIU Florida Executive Vice President, Ms. Roxey Nelson. Thank you all.
Hi, Joan. I love that you're at the work site and beaming in to welcome everybody to the launching of or the uniting of our We Care Committee call to invite the hospital members to join the long-term care and nursing home workers in this space. The long-term care team had been calling the Continuum of Care Committee, which speaks to how healthcare delivery happens here in Florida throughout the country. And that the idea is that care doesn't just happen at home or in nursing homes or in hospitals, that there's a continuum of healthcare that we should be all concerned with. And we've taken the effort to rebrand the space, the We Care Committee, to underscore that healthcare workers are the ones who, during the pandemic, who had to go and put their lives on the line to care for community. And that we literally are the ones who care, figuratively and literally. And so that's why we renamed it. And also just that nursing home workers and hospital workers, when we look at what the core problems are, the problems are the same. This space is just to shine a light on the most pressing issues facing caregivers and our patients, for those who are friends of and allied with healthcare workers in the state. And tonight we want to facilitate a discussion on how healthcare issues are most urgently being dealt with in Tallahassee. As you guys know, we're in the swing of legislative session. We're almost at the tail end of legislative session. And at the beginning of legislative session, our political director, Coy Jones, who is actually traveling and can't be with us tonight, spoke to us about legislation and bills and issues we were hoping to move in Tallahassee, issues that would help hospital and nursing home workers make the push to say that safe staffing equals quality care, and without safe staffing, you can't have quality care. To say that living wages, if we want to solve the turnover crisis we're seeing in our nursing homes and our hospitals, that we have to pay healthcare workers a living wage. And if you don't pay them a living wage, you won't be able to recruit new workers, and you won't be able to retain the ones that you have, given how hard the work is we're asking healthcare workers to do. And in general, we want to share about the healthcare access issues that are going on in Tallahassee, the general healthcare access issue that we care about as healthcare workers, because we know that a community that's, a community that's healthy has to have access to healthcare, right? If you're sick, you need to be able to go to the doctor. You have to be able to afford it. You have to be able to make choices about where and how you receive care, and what that care looks like, and have the freedom to do that. So with that, I think what I want to do next is introduce the panel that we have this evening. Representative Rayner, if you don't mind.
Hi, everyone. So wonderful to be with you virtually in this space. I am here in Tallahassee in my office. My name is Michele Rayner-Goolsby. My pronouns are she, they. I am a state representative for District 62. And so that is on parts of South St. Petersburg and parts of what I believe West Hillsborough. Yeah, I had to do the math in my head. West Hillsborough.
Thank you so much, Representative. We so appreciate you taking time out of what we know is a hectic schedule to be present for healthcare workers today. So thank you very much for that. I'd like to call on Floor, if you would come up and introduce yourself to the group.
Hi, my name is Flor Oliveira. I am a registered nurse at HCA Woodmont Hospital in Tamarack. I've been employed there for a little over a year.
Fantastic. Thank you, Flora, for being with us to share your story this evening. I'd like to call on Blanche, if you could tell the folks who you are.
Hi, I'm Blanche Norwood. I am a certified nursing assistant at a long-term facility for the past 47 years. And I'm happy and honored to be here on this panel tonight.
Thank you so much, Ms. Blanche. And Andrea, if you're here.
I'm Andrea Gheen, and I'm part of your government affairs advocacy team. So I work on issues that affect all of you in the Capitol.
Beautiful. So wanted to thank Representative Rayner-Goolsby, want to thank Flora, Blanche, and Andrea for joining us this evening. We're going to get started. Representative Rayner, if it's okay, I'd like to start to give Andrea a chance to give an overview of sort of how things are going in Tallahassee. 1199 had legislative priorities this session, and I'd like her to give an overview of how she felt like we did, since Coy's not here to do it, and sort of like what's coming up next. So Andrea, we're going to turn it over to you to kick us off.
Awesome. Hi, guys. So this year we had some great legislation that Rep. Rayner championed for us, along with Leader Book. And it did a number of things. It started out really expansive, and we took it down to something that we thought we could move and pass. And so far this year, it hasn't been heard in committee, which means it's not going to pass this year. However, we've gotten a couple pieces pulled out, and one of them will pass this year. One of them may pass, but we won't know till this week. And we did healthcare provider accountability, HB 1365 and SB 1466 on behalf of you all this year. What that did, or what our bill did this year, is protects healthcare workers in hospitals, ALFs, and nursing homes from liability on unsafe assignments or directives from a superior. So we know a lot of you all may have staffing you don't, feel is safe, or may have had things told to you during COVID where you had to reuse PPE and whatnot. And this just makes it where it protects your license and you as an individual when there are circumstances outside of your control. They have that for the hospitals, they have that for the nursing homes, but we want to protect you. It requires nursing homes to report their ownership structure. So we have instances where the nursing homes, they own the building, they own the staffing company, they own the nursing home practice, they own the PT company, and that way when they get Medicaid dollars, they can put them in those various places. And we want to make sure we know where all those Medicaid dollars are going to, so that we can make sure they get to you. Reporting on the PCA program. So the bill required nursing homes that have the personal care attendant program to report on how it's working out, how many people pass the CNA exam, how long they're in the facility, and how they're doing in the facility. And the two parts that we have that are going to pass this year and may pass this year are, we incentivize nursing homes to treat workers better by rewarding them with better reimbursement rates based on retention of CNAs and nurses. So that means if they can keep you in your position, then they get reimbursed better by the government for patient care. And that means that more of that money can go to you. And that part is in the budget this year. So that's going to go through. And then we required nursing homes to spend more of their Medicaid money on direct care workers. So that's you all, people who work with, around, or touch patients. And we're working on getting that into the budget. So we'll see if it goes this year. However, Rep. Rayner helped us gain a lot of co-sponsors on this bill. And we have a commitment from the leadership in the House and the Senate that they will get legislation passed for us in the coming year. And we've got a short summer and a session coming up quick. So that means we're going to get things done for you in the coming year. A lot of times it may take 5 years for a bill to pass, but doing it in 2 is a big deal. It's something that isn't easy. And you know, you guys coming up to Tallahassee and reporting on your assignments and documenting incidents as they happen, that's what's making this work. So your FaceTime with legislators is everything. You guys coming to these committees and documenting is everything, and it really makes a difference. So keep fighting, and we're going to get some things done.
Thank you so much, Andrea, and the whole political team for all the hard work. And I love the acknowledgement of the knocking on the doors, the lobby visits, the phone calls, the emails that some of you have sent to tell your story and let them know the reality of what's happening in our nursing homes and in our hospital has made all the difference. I want to ask Representative Rayner to react a little bit. I'm going to throw a little bit of a curveball. One is like, just thank you for agreeing to carry this important legislation for hospital and nursing home workers in the state. And you know, if everybody could give Rep. Rayner a little bit of love virtually, so she understands how much we appreciate her picking up this legislation for us and carrying it. But I wanted to ask you to take a step back, because Andrea talked about how our bill and our ideas moved or didn't move in Tallahassee this year, and looking forward toward next year. We won some small pieces, and there were some big pieces left on the table that we have to come back and keep fighting on. I'm curious, the power dynamics in Tallahassee are very skewed, right, to one side to the other. Could you just talk a little bit about those power dynamics in Tallahassee and how it impacts you and how you choose what, you know, the bills that you choose to carry, and then your ability to see that through, and what is most important that you understand for the communities that you represent? Would just love to get your perspective for the membership about what it's like being a legislator, and what are those power dynamics like, if you don't mind.
Well, first, thank you so much again for having me. And it's been a treat to work with Andrea and her team as we are shepherding this legislation, and also your members as well. So first, I will agree, you know, obviously we wanted to really have this piece of legislation heard, but we do have a commitment from leadership that next session that we will be getting these pieces of legislation heard. Specifically, one of the leadership members told the speaker, like, I made her a promise, so this has to happen. And that really comes from building relationships. And so to your point, Roxy, you know, yeah, it's really skewed here. And I think that one of the ways that I've been able to get things done is by being principled. I am principled in what I believe in. I'm principled in making sure that I stand up for the community that sent me here, which includes a good number of 1199 members, but also knowing what I can compromise on that doesn't compromise my principles. And so I think that that's really kind of where I've been able to see the success. And I also think, you know, one of the reasons that I think we've been able to really have these meaningful conversations when it comes to our workers and what they need is that I frame it. And I know, Angela, you do this as well when you're talking to lawmakers. We frame it in like, this is people in your district. This is your family. This is your, you know, your friend. And not talking about it in a way that's so far off, but these are people that you interact with every day, whether they're in your immediate circle, whether you're people that you serve. And so, workers in 1199, they don't just reside in blue districts, they reside in red districts as well. They reside in purple districts, and really making that case. But I want to really highlight, and I think Andrea touched on this during her comments. I always say, people are like, well, Rep. Rayner, like, the power dynamics are this and it's a little skewed and da, da, da. I always believe presence is power. Presence is power. And so when members come and they speak to lawmakers, they have press conferences, they do actions at the Capitol. And while you may say, well, what does that really do? Because the power dynamics are different. I hear the conversations in the members' lounge. I hear the conversations on the floor. I hear the conversations of, I don't know. I just literally, as I was coming up here on the elevator, I was telling a Republican member, hey, I'm about to go meet with SEIU. They're like, and he was like, oh, okay, yeah. The nurses, the workers, okay, oh yeah, what are they talking about? Like, and literally was kind of nervous, like, what's happening? And I'm like, it's okay, like, it's fine, we're just doing a briefing. But so while you may not see something tangible in this moment, you have to know that your presence is actually moving things. Your presence is signaling that maybe the way that leadership is looking at an issue is not the appropriate way they need to look at an issue. Maybe the way that they're thinking about when it comes to workers' rights and the things that y'all need, that they're not looking at it in the appropriate way. So I'm a big believer, no matter the numbers and the math, that presence is actually the thing that makes the difference. And that's what we've been seeing. That's why we've been able to have meaningful conversations with leadership. That's why we do have a commitment that things are going to move next year. That's why we do have a commitment that we're going to find little pieces in of the bill and other parts of the bill. And I've been very clear, like, I don't have to have my name on it. Like, it doesn't have to have my name on it. I just need the policies to pass, right? And so I think that's also the other part, Roxy, of not having the ego where my name has to be on it. If you want to fold it up in someone else's bill and that means it passes, great. That's fine. I don't care. As long as that the policies that make sure that our people have what they need are passing, that is what that's what we do. And all of that, I think, is a part of strategy and just being strategic of how you have to move things. And so that's what I would say, like, when we're thinking about navigating, policy, especially policy that's important to 1199 members, and making sure, and once again, I think that ultimately, though, your presence in Tallahassee, the folks that are able to get here, is so powerful. It really changes the atmosphere.
Thank you so much, Representative. Y'all just got a Michele, Representative Michele Rayner quotable, presence is power. Let's remember that as we go about continuing to advocate for our issues, that our presence is power. The next question I want to ask around nursing homes, and I want to ask Ms. Blanche, this one's for you. Let me find it. So I ask it. It is very detailed. Okay, it says, there always have been staffing issues in our nursing homes because of low pay for a very demanding job. This became a severe crisis during the pandemic, when nursing homes were ground zero for COVID-19. So the Florida legislature last year, due to our hard work, all your calls, all your, showing up and being that powerful presence, it did a budget rule that nursing homes must pay workers a minimum of $15 per hour to help relieve this staffing and retention crisis. But a year later, we find that almost half of the nursing homes who have subcontracted workers are not complying, and instead are using loopholes, payroll tricks to avoid paying the $15 an hour. I want to ask Ms. Blanche, I want to ask you, as a longtime caregiver and a member leader at 1199, how do low wages impact nursing homes, especially during this staffing crisis? And how will a $15 minimum wage being implemented across the board right now improve care and the lives of workers? Can you answer that question for us, Ms. Blanche?
Yes. the $15 would enhance a lot of stuff because it will guarantee that people will be able to come to work and they will be able to feed their families. Yes, $15 is not everything that we need, but it's going in the right direction. When they're paying low wages, people are not able to feed their families. They're working 2 and 3 jobs. And sometimes the people that are subcontracted out, they don't feel good. They don't want to come to work because they feel like they're overworked and they're not valued and they're not being paid the money that they deserve. So we need to step up our game. I mean, I know that the union is doing everything possible to try to get these people brought up, but the CNAs have been brought up, and that's a wonderful thing because that helps with the retention. Because when they see other facilities paying more money, that's where they want to go, to these other places instead of staying here. And when the subcontract people see that the CNAs got the $15 and they didn't get it, it's low morale. And then they're not doing their job to the best of their ability because they feel like they've been overlooked.
Thank you so much. That's really thoughtful perspective about how that's impacting morale. Thank you, Blanche. Representative Rayner, just curious, hearing that, what Blanche has had to say, do you have thoughts on how elected officials, lawmakers like yourself, could just shine a light and encourage long-term care facilities and employers to follow the law and as it was intended last session and pay a living wage, pay $15 minimum wage to the subcontracted nursing home workers? Do you have ideas of things that lawmakers could do to help us make our employers comply?
Yeah, I mean, pass a bill that has an enforcement piece into it, right? Pass a bill that says that if they don't follow the law and have a living wage, for folks, that there will be fines. I will guarantee you that people will get themselves together and they will figure out how to do it. Because here's the thing, my mama always says this, there's money out there. There's money out there. People are like, oh, I don't have the money. No, there's money out there. People have the money to pay for what they need, especially these corporations and these facilities, and they will do and pay who they want, what they want, where they see value at, right? And so if I value, I'm going to pay you what you need to have a living wage. And I think the tool for us is that, and I think the flaw is there, that then if any enforcement piece that's there is not impactful enough to make sure that people follow the law. So we have to come back and probably fix a glitch in that bill when it comes to enforcement. If you are not paying a living wage, if we do an audit, if we get reports that you're not doing that, this is the consequences of that. And I think that unfortunately, people are motivated by money, right? And so unfortunately, that is the way that I think that you will start seeing those changes when people are actually held accountable by, whatever, agency, ACA, DBPR, whatever, that they're actually held accountable when it comes to that.
Thank you so much, Representative. And I think that, that's something for us to think about, Andrea, for next session. I also wondering if short of that, if we're, it's like we said, dynamics are hardest in Tallahassee, doing things like often we find that our employers, they don't like attention. So doing things like getting a letter from a state representative like yourself, or getting a phone call asking and inquiring about the wages that are being paid are things that also work to incentivize elected employers to do the right thing for workers when we shine a light and the public and the community pays attention to it as well. And so I appreciate the nudging on we probably need to go back and fix it. The thing that is really frustrating about it is that we know that we already fought and won a living wage to 15 by 2026. So what we're talking about them is about 2.5 years of them just not wanting to do it, even though they know that it's the right thing. They're going to eventually have to do it, but they're denying our EVS and dietary workers that right. So we're going to keep strategizing on how to keep the pressure on in our nursing homes, and we'll call you in, a representative, as we start to brainstorm for those ideas legislatively and then back in district. Next question is for Flora and for hospitals. It goes something like this: the staffing and retention crisis has grown much worse in hospitals since the pandemic. Flora, one of the largest and most profitable hospital corporations in the country and state, the Hospital Corporation of America, HCA, is one of the worst examples, with staffing levels well below industry averages and disturbing statistics about patient care outcomes, all while HCA makes billions, $58 billion to be exact, in profit each year, in revenue, and I think it was like 18 billion in profit. Our union is currently in bargaining for a new contract that helps solve the staffing crisis and provides proper pay and protections for hospital workers. And Flora, thank you for being here. As an RN at an HCA hospital, we're curious, please tell us how the staffing shortage impacts patients and workers. And please explain how you think securing a strong contract will address this and other critical issues.
So in my role in the ED response area, which is the emergency psychiatric unit of the emergency room, we have severe short staffing issues. These issues endanger patients and staff. In the last 6 months, we've had over 13 employee work-related injuries. Some that have even had to have surgery and be out for more than 3 months. In my unit alone, there's only 8 nurses, 4 during the day, 4 during at night, 2 scheduled at a time. And out of 8 of us, 4 of us have already been injured in some shape or form. So not only is it very stressful, but it also causes burnout. We are required to work extra weekends, which is against policy and union contract. We're expected to assist and do more when we have surges, regardless of how many patients we have in front of us and how many patients are waiting still in the main ED. Some of the things that I have seen that have been absolutely gross and disgusting in that particular unit, one of the, and I am a very big nurse advocate, our unit is not properly completed or modeled in a way that would allow for privacy. So there is absolutely zero privacy when you're talking to a patient. Everybody can hear everything. Also, minors. So adolescents and children under the age of 17, from ages as little as 3, 4, and 5, up to 17 years old, are placed next to these adults who are not only ultraviolent, but are also sexually acting out. And this is what we're exposing our children to. Also in our unit, we have to give a lot of medications that are very sedating for patients. And we're required to ensure that they don't fall. How do we do that when there's only 2 of us and 9 of them? We only have a pair of eyes each, and there's no way that we can work and keep eyes on the patients at the same time. When there's a crisis, which is practically every 30 minutes to an hour, it's all hands on deck, meaning both nurses and both techs are attending to that one patient, leaving the remainder of the unit to fend for themselves. It has happened before where patients have escalated as a result of that one crisis and have ran over to either help or fight staff or police. And the police have their guns on them when they go to our unit. Which brings me to my next point. There was a huge incident where if we had had more staffing available, perhaps this would have been avoided at all costs. But I guess the police that day had chased the boy down. He was an adolescent minor, and they were frustrated with him. The information that we were given by our director the day before was that if the police is present, they are to assist, even though that is not their role when they're in the hospital bringing in a Baker Act. And ultimately what ended up happening was that the police officer beat up a minor that was handcuffed and shackled and he broke his hand in the process of doing so. Medical patients, so psychiatric patients that have medical conditions are required to wait on hard recliners for over 20 hours for a medical bed because there is no staffing. There isn't extra nurses. There aren't extra sitters available to sit and ensure safety. And patients that are difficult placements, for instance, patients that have autism, patients that are pregnant, patients that have complex medical issues, have to wait an average of 30 to 50 hours at times for a medical bed. We don't have any pharmacy available after midnight. So whatever's in the Pyxis is the only thing that we're able to give that delays care. We don't have dietary. So if I have a patient that comes in and is diabetic on insulin, there's no sugar-free food to provide because there's no one in dietary to provide that. All they get are sandwiches and juice. There's no actual meals prepared or anything like that. In my time there, overall, there have been 13 employees injured, several with broken ankles. Some have been bitten, some have been kicked, strangled, scratched, broken skin to the point that they required specialists for workers' comp. And overall, if HCA added even just one security guard to that unit, that would help prevent a lot of what is going on. Because as soon as the patients see that there's someone in uniform, you know, they hold back a little bit more. And ultimately the care for the patient, you know, how satisfied are they at the end of the day with our care when it's constantly being delayed? Nobody there gets care right away. No one gets a bed, a medical bed facilitated to them. I have to go above and beyond, and usually I have to tap into the house supervisor to see if I can get my patient that it requires medical attention. It's supposed to be on a telemetry unit with a telemonitor. It has been sitting in my unit for 20 hours waiting to see if we can try to expedite something. And it's always the same thing. We don't have enough sitters. We don't have enough nurses. If we have a patient with COVID, we don't have a nurse, you know, that's already been assigned to take care of COVID patients. And these are patients that have to sit and wait in our unit. So not only does it cause an issue for the community, but overall it creates just a snowball effect of what happens. So everything is delayed, then the patients get delayed even more so by ending up in the main ED. And then the police officers are so frustrated with having to wait there with the Baker Act patients that they're no longer wanting to come in. They just drop them off at the door and hope that everything goes well. Well, that backfired my last shift where a patient proceeded to strangle a tech. And it was, again, very heartbreaking. And it definitely affects the morale of everyone. It's hard to see your coworkers get hurt and not be able to do anything. It's hard to have to cover all of those extra shifts, regardless of how tired you were. It's exhausting to have to work every weekend and not have enough time to spend with your family or your children. I would like to see a change. I would like to encourage HCA to put a little bit more focus on safety. In other hospitals that I've worked at before, safety has always been a priority. That does not appear to be the case here with HCA. Safety is on the back burner. Numbers and algorithms are in the forefront.
Thank you so much, Flor. That was so, I mean, that's, I don't know about everybody else, but the description was so impactful to me. Representative, I'm wondering, as you know, you listen to Flor describing what it is to work in a mental health emergency unit, like what is your reaction to that? Just give you a chance to just react to everything that she shared.
Well, first off, Flora, thank you. I know that obviously you have been a nurse, I believe you said for 27 years. So like this is like your calling and this is the work that you truly love to do. Um, my reaction is really corporate accountability. HCA knows. I'm assuming that no one has not said anything. I'm assuming that this is not something that is they're unaware of. And there's only so much that our nurses and our CNAs and our techs can do. And when you don't have the proper staff, when you don't have the proper safety precautions, when you don't have the things that you need to do, not only to keep our workers safe, but to keep patients safe, that's a problem. And so I think about, from a legislative perspective, right? I think about what are we able to do? We have ACA that's supposed to be this agency that's that's supposed to make sure that folks are compliant. And what I have found and what I have seen, and I know conversations that Roxy and I've had, and I think Andrea, like you and I've even had this conversation, like people do things because they can. They do them because if they feel that there's going to be no consequences to their actions. And I think, one, there has to be a light that is shined. So I'm all about actions and civil disobedience, but I also understand that people need to make sure they have a job, right? So like we have to balance that. And so in my position, I think that, there should be ways that we are able to pop in on these facilities. We're able to pop in on correctional facilities. We're able to pop in on local jails. There should be a way for us to, and Andrea, maybe we need to write this down, think about making a bill, especially if these people are getting state money. Like I should be able to pop in and like just unannounced and see what's happening. That's number one. Number two, there should be, to Roxy's point earlier, definitely bipartisan effort, I think, to make sure that we are getting a letter and requesting information they may not want to give out, right? To the point that Flora made. How many people are getting hurt? What does that look like? What are the incident reports? All of these things. And that's going to be like, dang, they want information. And I don't know how I'm going to get that information, but it's well within my purview to ask for that if you're asking for money from the legislature to fund your hospital and pay your workers and do those things. So that's number two. And then number three, I think it's just more stringent accountability and legislation. And so for me, it's sad that I'm not surprised, right? But I think that I believe in putting our money where our mouth is. And so for me, those are the things that come top to mind, those three things I just listed that come top to mind rather quickly.
Thank you so much, Representative. We're coming to the end of our time together, and I want to give us time to just wrap up and hear from each of the panelists and then close out the conversation. There are two additional questions that we wanted to surface, and so one was about transparency. There were elements which you and Andrea already talked about, Representative, in our current bill that would make nursing homes more so have to open up the books to share, sort of to your point, getting the information so we know how they're spending the resources and what's the impact of how they're spending those resources on quality care, especially to your point, since 70% of nursing home dollars are public dollars. And seen with our hospitals, a lot of people don't know this, but our hospitals are for-profit, even our for-profit hospitals, 40 now during the pandemic, 50% of their dollars are public dollars, and people don't recognize that or realize that. And so we will be, I think, calling on you and many other legislators and friends, where we have, I think, a couple of hospitals in the St. Petersburg area with HCA right now, where I think that's a brilliant idea that we should write them a letter and have legislators around the state, bipartisan legislators, calling on them to say, hey, we heard this, what's going on? Just recently, Gus Bilirakis and Marco Rubio sent a letter to HCA asking them about the cockroaches, right? That was reported that are being found in their facilities, and why is that? And I think we can do more of that. but to push for transparency. But I wanted to, before giving you each a chance to close, I want to read you some stats and then give you a chance, and we'll go in order and let you close this out, Representative. But let me read it, find the stats and read it to you. It says a recent study showed that more than 70% of US healthcare workers have symptoms of anxiety and depression. 39% have symptoms of post-traumatic stress disorder, and 15% have had recent thoughts of suicide and self-harm. Despite the perception that healthcare facilities are safe spaces, workers and in the industry, to Flora's point, are 5 times more likely to experience workplace violence than all other workers. And around 47% of doctors and nurses plan to leave their jobs by 2025. To Blanche's point before about turnover and not being able to keep people. Turnover rates for allied professionals is about 40% in a hospital settings, but 70 to 80% in a nursing home setting. 29% of all healthcare workers affirm that they have considered no longer working in healthcare. We know we live in a state where, you know, we are living longer. We call people to come here and retire. Our technology is making us live longer, but then we have more chronic diseases. We are gonna need healthcare, long-term care, acute care. And so just hearing those stats, I'm curious. I'm gonna start with Flora, then I'm gonna go to Blanche, and then Andrea, and then Rep. Rayner for you to close. Just what is hearing those stats bring to mind for you, and like what do you want folks to know, or how do you want us to focus as a union to take this on, or should we take this on? What do you feel like we should do? So Flora, do you want to give us about a minute on just your reaction to hearing those stats?
My goodness, it's incredible. I would like to see more nurses, more support staff, whether it be techs or security guards available. I'm sorry, can you re-ask the question again?
No, yeah, I think that's a great answer. Your camera went off, but just simply like after hearing the stats I just read about the level of turnover, the workers who healthcare workers wanting to leave the workforce, the amount of anxiety and stress that are you know trauma that are in the bodies of healthcare workers. What is your reaction to that, and what do you think our community should do to respond to that?
Yeah, that's a very difficult question because personally, I would like to step out into a safer environment, and that has not been the case. I've not been able to do that just yet. There's a lot that happens from above, from the powers that be, that sometimes prevent us from being able to jump to a healthier environment. And go ahead.
Keep going.
And in terms of patients, I would like patients to not suffer. You know, to have a psychiatric patient with a psychiatric condition, but who comes in mostly for a medical condition. Can you imagine having to wait 20 hours, 30 hours, 40, 50 hours to obtain care, to be assessed properly? I would really like for those patients that require medical attention to get that medical attention within a certain amount of time. There has to be some type of something in place that should enforce ratios, nursing ratios. California has it and it works well in that regard. I think Florida needs to be moving in that direction as well, as our population has increased and our mental health population has more than tenfold at this point. And there aren't enough resources, there aren't enough staffing. So, but please go ahead.
I was just saying thank you. I don't know, so I think someone cut in, but I think that's a great answer. Staffing ratios, prioritizing staffing ratios feels really important. Aaron, if you want to mute us all again, and then we'll have folks come off and mute so we can lose that. Okay. I don't know, Blanche, I don't see you. If you're there and you want to respond, I would be happy to hear from you.
Okay, in the nursing home industry, we need more staffing because, as you know, the last time our bill was reduced, so the staffing level is not good. That means that we have more in-house bed sores than we used to have. We don't have enough staff to properly turn our residents when they're supposed to be turned or to feed them when they're supposed to be fed. So we need the nursing home to be more transparent as to the reason why they cannot afford to give us the people that we need to work with, because these people are the pillar of our society. They've been so aggressively mistreated because we don't have the hands-on to do what it is that they need to do.
Thank you
And
so
most
much,
of the people that are here is
Ms. Blanche. Give me 1 second. Let me let Rep. Rayner say goodbye. She's about to
Okay.
hop to go do Joy Reid, so we want to let her go do
Okay.
that. But say goodbye, Rep. Rayner. We are so grateful to have you on. Go ahead.
Thank you so much, y'all. I mean, yes, I'm so sorry. I would love to stay, but I'm going to do Joy Reid to talk about all the foolishness that's happening in Florida. But I honor all of your members, all of the members here. Thank you so much. Roxey knows how to get to me personally. So does Andrea as well, like personally, like Roxey could pop up on my house. So, if you need anything, please let me know. Even that's not necessarily legislative wise. I am here. I am to be an accomplice and a co-conspirator in making sure that y'all have what you need, and just honor you, love you. Thank you so much, all of y'all, for all the work that you do, and every day still serving our people day in and day out. So love y'all so much.
We
Thank
love you and tell Joy
Thank
we said
you.
hi.
I
Tell
will.
Joy
Bye.
we said hi. Ciao.
Bye.
Okay. Ms. Blanche, go ahead and finish up and then we'll wrap. Go ahead.
Okay. I think that they should be held accountable as to why we have to have such a low impact with the CNAs that are working to do the job, because the job is very strenuous, it's very heavy, and we need hands-on in order to do what needs to be done, because our seniors deserve to be treated better.
That's right. Thank you so much. And Andrea, do you want to react and share your perspective?
Absolutely. I definitely want those stats because I couldn't write as fast as you were telling them to me, but but I need those. Keep a list of changes you want to see in your facility with your organizer in your facility or in your area. Keep documenting what's going on and sending it into the union, I would say, were my thoughts. And we'll try to make those changes happen, you know, either little by little, or when we can get a big change, we'll try to get a big change. But you have a team here working for you and in trying to make changes in the government that regulate these places that you work. And it's everything with your involvement. And I would say the other thing is, you know, keep coming up here, keep visiting, keep making phone calls, keep sending emails, keep writing the letters, like the letters that people sent on the minimum wage and everything. I had my spouse help me translate some of them, and then took them to leadership up here, and they were moved, and I was moved. And so that's something people are looking at, that legislators are looking at. So just keep staying involved, keep fighting, and you have people on your team.
Thank you so much. I want to appreciate our panelists. Y'all can, if you're going to go watch cable news when we're done here, you can go watch Rep. Rayner hold it down for Florida on Joy Reid tonight. I want to thank Blanche, who's always so wonderful in articulating what's happening in our nursing home. And I want everybody to give Flora, who's a new member leader and activist, for so brilliantly laying out in a heartfelt way the experiences that she's seeing, and I saw so many of our hospital workers are seeing in our hospitals, especially our HCA hospitals. I want to name that we have 1199 to Rep Rayner's point and Andrea's point. Like, we have to keep making our presence be felt, that our presence is our power. I love that. Today, in the last couple of days, we had 50 to 60 HCA workers from around the country, 20 of them or so from Florida and Tennessee, marching on corporate to let them know that HCA workers are not going to take it anymore, and that we are serious about the proposals we have put across the table in bargaining, and we are not giving up. We're going to keep up the fight and make them have to answer for what they have been doing and how they've been treating their patients and their caregivers. And then a delegation of about, I think, 10 nursing home workers were in Washington, D.C. this week with our long-term care team, and maybe hundreds, a couple of hundreds of other nursing home workers and home care workers across the country to encourage the Biden administration to make a national regulatory change that would set a floor for safe staffing standards in our nursing homes, which is massive, especially for a state like ours, where in Florida, the politics doesn't lend itself for us to be able to win that at the state level, as Andrea would tell you. And so just really appreciate the many ways, everybody who helped put the ReCare committee together, our political team, our communications team, our hospital division organizers, and our nursing home division organizers, to keep the momentum going, that we are not going to quit fighting. Right now, I'm hearing that the nursing home workers nationally are saying 25 should be the minimum. I'm hearing hospital workers in New York just won 8%. 7%, 6%, I think I got that right, over the next 3 years in their wage, and pushing Governor Hochul in New York to make sure she does right by hospital workers in New York and 1199 members in New York. We want to keep this going in our fights here in Florida, and we invite all of you into whether it's attending a chapter meeting so you can figure out what's going on, asking a coworker to join you in that chapter meeting and to join the union and become a part of the fight to do better for healthcare workers. I know everybody is like, they're going to just walk away and go somewhere else, but there's no place else to go. This is an industry-wide problem. And so if you want to, if your vocation is healthcare and you believe in what you're doing, then stay here and fight with 1199 to make it better. And we want to call on every healthcare worker, nursing home worker, home care worker, hospital worker to get in that fight and lean in and help us do that. We're going to continue on May 18th. There's going to be another ReCare committee meeting on May 18th. We're going to have another guest speaker, another dynamic presentation, so that we keep the drumbeat going about the need for quality care in our nursing homes and our hospitals. And we're going to be going up to Tallahassee on May 2nd and May 3rd with our community partners, with the Black Alignment Group, really talking about the things that are happening in Tallahassee and how they especially affect the Black community, and giving our Black members a chance to go up and exercise that part of their voice. We invite everybody to participate in upcoming events, like on April 27th, there's a messenger training put on by the Black Alignment Group, so folks can participate in that if they so wish. I really appreciate, I don't know if there are other slides, Desiree, that we need to show. Desiree wants us to know that you can, go to that website she just dropped in the chat to continue sharing your staffing stories, just like Flor did, just like Blanche did, in spaces like this, to the media, writing op-eds, writing letters to the editor, speaking out. When Ed calls you and says a reporter wants to talk to a healthcare worker, say yes. The only way we're going to change things is by being willing to tell the stories of what's happening, being the advocates for ourselves, for our families, for our communities, and for our patients. And so I just encourage you to document, tell the stories, encourage your coworkers to document, encourage your coworkers to join 1199, be proud to be in your union and to be fighting to make a change. So I think, Desiree, that I've done everything you've asked me to do. Is there anything else left to share or say to the team here tonight? She wants us to fill out ADOs. She just keeps dropping things in the chat, and I'm following her. But fill out the assignment despite objection form. We want to make sure that, you know, we're protecting our licenses, right? That we are affirming that when we see from our clinical opinion that something's unsafe, that we are documenting it. And as healthcare workers, we're standing on that principle and forcing our employers to own their decisions that they're forcing us to make. So encouraging you guys to do that as well. Any questions as we wrap up? Any questions for me, for Flor, for Blanche, for Andrea? And Aaron wants us to ask her, he dropped another link in the chat asking legislators, you can email your state senator, your state representative, and ask them to co-sponsor our bill. Like Rep. Rayner and Andrea said, we're not done. When this session is over, we just keep fighting, right? We're tenacious and we're determined, and we're gonna go back again. We're gonna lobby them all summer, and we're gonna go back again next session. So write your letters, let them know you want them to co-sponsor our bill. There's still 2 weeks left in session, and we wanna get as many legislators saying this is a good policy, good public policy that we can. So click the link Aaron just dropped in the chat and ask your state legislator, state senator, state representative to sponsor our Nursing Home and Hospital Transparency and Accountability Act. I think that's what it's called. Amy Runkle's hands raised. I love me some Amy Runkle. Hi, Amy.
Hello, everybody. Hey, I just wanted to let everybody know, I got a text message about, I don't know, 4 days ago, and I've been talking to a reporter from Newsweek, and I had given her an interview over the phone quite a while back, and she just reached out to me again and wants to spend a couple days with me. So she's actually flying down here on May 19th, and her and I are going to spend the 21st and 22nd together. So yeah, she wants to hear more about what's going on, and you know I'm going to put it out there. So
yes, go get them. Yeah. Go get them. Anybody else? Anything to share? Any questions to ask? Go ahead, Joan Phillips.
Hi, hello everyone again. This is Joan Phillips from 1199 ACIU. I just want to say thanks, Ms. Roxey, for allowing me to speak, Ed, and Ms. Desiree. Thanks, and thanks to all the representatives and everyone here tonight. It's important that we all come together to discuss these critical issues, the one of many things we can do to find solution. There are some other concrete related steps to make sure our employers respect us, protect us, pay us, and staff us, and solve the crisis. First, please document staffing issues at our facilities, especially by filling out the ADO forms. Encourage our coworkers to join our union. We are stronger in numbers and unity. Related to this, please watch for communications to join the Black Alignment Group for a message training on April the 27th, 2023. And please join us May 18 at our next We Care Committee meeting. Thank you all, and God bless you. Thanks.
And everybody, good night. Thank you for hanging with us.